guys. Welcome back to RT Share Tea, where respiratory therapists live out loud. With me, your host, Linda Fry, the Asthma Lady. Yes, welcome everybody. Welcome to anyone new. And thank you everyone for the support, spreading the word and just supporting me. All right, guys. So super appreciative. Now, today I'm very excited because I have another guest co-host, and this one is amazing. Yes, we have Dr. Damien Fisher, who I know through in the social media space, and we often bump into each other because of the patient advocacy space, and he's also an asthma educator. So this is amazing. And I can't forget, he also has a work history with respiratory therapist. So it just made sense to have him on. So super excited to have Dr. Damien with us. And what I'm going to do is I'm going to read his bio and I'm going to let him do his thing. Okay. All right. So Dr. Damien Fisher graduated from Florida A&M University College of Pharmacy with a Doctor of Pharmacy degree in 2004. He prolonged his studies and completed an ASHP accredited residency with an emphasis on community and ambulatory care at University of Tennessee. He became intrigued in academia during his career. He has held 3 clinical assistant professor positions at Hampton University School of Pharmacy and University of Houston College of Pharmacy, as well as South University School of Pharmacy. His passion in the ambulatory care world is within the area of pulmonary and dermatology. He is currently certified as an asthma educator and is heavily involved with the American Lung Association as a national presenter. He serves as a board member to the National Asthma Certified Asthma Education Board, advocating for asthma educators' opportunities. Damien is also a board member of the National Board of Respiratory Care. Damien currently works at the UTMB Health League City team as the outpatient allergy and dermatology clinical pharmacist specialist. Wow, Damien. You do a lot.
Yeah, I guess so. Long in the tooth, though.
I'm like, wow, amazing. So thank you so much for being here with us. And we're just so excited to hear your perspectives on everything that you have done. And like I said, we've been bumping into each other because we in a lot of the same space. And so I would love for you to share your story on how you ended up. I don't know too many pharmacists
Yeah.
that are certified asthma educators and on the National Board of Respiratory Care. And so you're kind of unique. So
Yeah.
very excited to have you on. So what I usually do is with guest co-hosts, I always want them to share the story of how did they get into the profession that they're in. And so you can share your story of, so what made you decide to be a pharmacist?
Well, tell you the truth, I was a teacher by trade. I knew I wanted to be a teacher, a presenter, way back in high school when I was like a vice president of the school. And I wanted to teach chemistry. That's all I wanted to do, be a high school chemistry teacher and also be a JV basketball coach. I told my parents that, and my parents looked at me and basically said, no. They were like, yes, you can go into chemistry, but you have to strive a little harder. Because both my parents are teachers by trade as well.
Okay.
And
Makes
they
sense.
wanted me to do something in the medical field,
Okay.
in between
Of course.
dentistry and pharmacy. And I worked at for those old timers that actually remember this. I worked at Eckert's Pharmacy as a pharmacy technician, and I fell in love with pharmacy. And I basically applied to like 6 different schools, and Florida A&M was very homely to me because of the campus. I liked the campus and the spread. And so
Okay.
when I got into pharmacy school, I noticed that there were different opportunities, not just community pharmacy, but I think the best thing I can always tell students and the best thing I can always tell anyone is that you had to fit your attributes, your characteristics to whatever you are going to have a long career in. So I know I'm very loquacious, I'm very personable, I'm extrovert according to most people when they try to characterize me. So
Yeah.
ambulatory care just seemed like the best bill for
Yeah.
me. And I love talking to patients. I love breaking down concepts for patients. That aha moment, that
Yeah.
that brings me joy, right?
Love
That
it.
yeah, that self-rewarding thing about ambulatory care is what I love. So that the great thing about ambulatory care is basically you break down these concepts, you get those aha moments, but it's a self-rewarding to the point where, with asthma, you teach them inhaler technique, you teach them, these little nuances about triggers and things of that sort. And, you get to see the progression of their healthcare improving because of those little small little counseling tips that you give. And
Right.
yeah, so you can't get that in the inpatient side, because not saying, not belittling inpatient, but you can't get that self-rewarding aspect because you're fixing the problem and you're doing a great job of fixing the problem on the inpatient side, but sometimes you don't build that rapport with the patient.
Correct. Correct.
So ambulatory care was definitely for me. Probably the reason why pulmonary stuck with me, because I do have a history of pulmonary sarcoidosis, and there's no,
Oh,
yeah,
okay.
there's no pulmonary sarcoidosis clinics, or there could be. It's just not as big as asthma and COPD. So I wanted to help the pulmonary world the best way I could, and asthma COPD, it just spoke to me a lot. I really think I have a lot of good concepts that breaks down for patients to understand, whether it's regarding inhaler, regarding the pathophysiology of asthma, pathophysiology of COPD. I just think I do a better job of counseling patients and also being a great advocate for patients with
Love it.
using my background. So that's pretty much my story from high school until now. uh, I I just think pulmonary education is so underutilized within our society.
Yeah.
We can do a lot more preventative care, a lot more education to
Yes.
prevent our patients having attacks, exacerbations. And, I think the American Lung Association is a great platform. I
Mhm.
think, me being on a board is also opening the door for other pharmacists. And that's, pharmacists, I, they don't feel pulmonary. I don't know. There's a little stigma to me that they don't think it's a way to get in the door of education, but it's absolutely a way to get in the door of education. I like being the beacon for that.
Right. Let me say, Dr. Fisher, it makes so much sense to me because especially when it comes to patient education, when they go to pick up the prescriptions, that a pharmacist can really break down to them like why they have two different inhalers, or
Right. Mhm.
the difference between the medications. We see it often on our end. So as a respiratory therapist and a asthma educator, I've seen it so many times where the patients confuse the medication, and it's really just that can be resolved by just spending a little time and
Yep.
providing asthma education right then
Yeah.
and there. And so when I saw that, you were a pharmacist and you were, using your platforms to do that type of work, I was like, wow, it makes so much sense. And I don't see it. It should be done more. Yeah.
Yeah. And I think my first job, not my first academic job, but my first clinical job definitely taught me the nuances of not everyone has the same understanding as everyone else. Breaking down concepts is necessary. So working in the prison system and running an asthma clinic definitely showed me, we had to reach patients on different levels.
What?
Some are,
I didn't know you did that.
yeah. So for 10
That's
years, I worked in the prison system, running an asthma, diabetes, and chronic kidney disease clinic. And
wow.
asthma was definitely something that, because basically in the prison system, you pay money, you outsource money for them to go into an ambulance, for them to go into a hospital. That's not paid
Okay.
by, yeah, so that's not paid because there's no prison hospitals nearby. So you,
Mm.
you pay this higher price, this ambulance price, this inpatient price to these near hospitals to take care of a simple asthma exacerbation that could have been prevented if we used the right inhaler. So I used a color dot system there, which spoke home to most of the patients there in prison health. So breaking down those little small nuances can definitely reach patients' education, understanding about asthma and COPD.
Wow. I did not know that. I didn't know
Yeah.
that about the system. And look, that's another thing that you did. I didn't even have that in the bio. I was like,
No, I know. I mean, it's not like I try to hide it. It's just,
no, I
yeah,
love it. I
yeah,
love it. It really does. It just adds context to why you do what you do and how you do it. So no, I love it. So okay, well, you basically you gave me already the story kind of behind what led you to get
yeah,
what led you to become an asthma educator, to get certified as an asthma
yeah.
educator. So I wanted to know, so what was your, like, what made you finally say, let me go get that? And
Yeah.
how was your experiences taking the exam?
So I believe everyone has a niche in any type of occupation you go
Yes.
into, whether it's healthcare, whether it's being a teacher, or whether it's being, business marketing exec. Everyone has a specific niche that brings them joy, right?
Yeah.
Uh, Asthma brought me joy. There was no doubt about it. My passion's there. I don't get tired of talking about asthma. I don't get tired of talking about COPD. I don't get tired about talking about respiratory disorders.
Mhm.
There are other disease states I get tired about. So,
Right.
in order to be the top of my game, I could not find any other credentialing other than AEC, a asthma educator, to be at top of the game. I wish there was a COPD one. I think there's one in Canada that they do for certification, but
Okay.
there's not particular COPD one. But
Right.
I knew AEC was the top of the game to get credentialed. I did. I'm just going to be honest with you. The first time, I didn't really study, so just being honest. And what it wasn't the pharmacotherapy.
Yeah.
Yeah,
I failed. I
yeah.
ran out of time, actually.
Yeah, well, I failed too. I got 74. So the first, it wasn't the pharmacotherapy, it wasn't the pathophysiology, it was the
Yes, and
cultural,
so
social. Yeah,
I love the fact. Oh, I love it.
yeah,
You're doing it right now, because so many people, they think, because, oh, I'm a nurse, I'm a respiratory therapist,
right,
I'm a doctor, I'm a
right.
pharmacist, I could just go and take
Yep,
this exam. I know every discipline that have taken that exam and failed.
yeah,
You have to study for that exam. You
yes,
have to know how to take the exam, because
yeah,
there are questions. If you are not about that life, they're
right,
asking you about program management. They're
right.
asking you about
Mhm,
funding. They're asking you
mhm.
about cultural aspects, and
Cultural
how to
sensitivity. Mhm.
incorporate that in the education. It's yeah.
Yeah. I was like, I was saying, I'm like, oh, I did prison health, 10 years. And of course I'm cultured, of course I'm good. Right. So I was like, I don't need to study that. So, yeah, that part like did me in, and the funding part, the economic part, uh, the grant part, there's certain questions about grants. So, that just did me in, back then. So the second time I was well prepared and I knocked it out of the park.
Right.
So, but yeah, so my experience taking the exam was basically to study. I did
Yes.
take I did do a review course.
Yes.
I did some
So it's
study tips, talked to some other people, and I was successful the second time. You just put a little work into it along with your job,
right.
study on the weekends, and put a good, I would say, this is just me, so this is my opinion, put 2 or 3 months weekends. I think you're going to be well prepared. So I
I agree.
really, yeah, and I think because of the AEC, I have my platform for asthma definitely lifted off, especially with the American Lung Association.
Yes. It's not too
My
many of you. You're a unicorn. It's not too
yeah,
many of y'all.
yeah,
It definitely caught my eye too. I was like,
yeah,
oh, okay.
yeah, I love speaking for them, doing all
Mhm.
their virtual
Very good
presentations.
organization.
Yeah, especially for the COPD educator. I can't do the asthma anymore, but I can do the COPD educator that they
Okay.
do. I also took it. It gave me a great platform to speak at Breathers Club, Better Breathers Club.
I know.
So that's like more of a respiratory rehabilitation centers that they have all across Texas and other states as well. So I go there when they need out of my time and basically talk to them about talk to a group of patients to help them be mature in age. I don't like saying the word old.
Right.
Have them be mature in age and basically talk to them about inhalers and techniques, funding, prescription assistance programs, grant programs where they can get these inhalers and they don't feel like they're economically strifed. So I really, really, really appreciate the AEC credentials because it definitely let me be able to touch more patients and be able to engage my community more.
Nice. I love that. And like I said, when I saw even when I saw your profile on LinkedIn, it really it did catch my eye because I was like, yeah, I don't know too many pharmacists that do what you do. And so I commend you definitely the work that you've done and everything that you're doing, and especially around health disparities. And it's so needed. It's
Yeah,
and none of I don't feel like any of these problems are new. Like just going back in when I do my research and just these are not new problems.
no,
It's just that it's
they're
like, well,
ongoing and consistent problems.
you understand, when are we gonna start finding like solutions, like
Right,
real solutions
right, right,
to these issues? So
right.
it's yes. And so yes, we could segue into patient advocacy. So what does patient advocacy mean to you?
So I think it's a big umbrella. I think the first thing is connecting patients to outreach resources that are affordable, also is attainable for them. So it's
Right.
not only about getting them the medication, it's getting them the education.
Yeah.
It's also getting them the actual provider help. So one of the things that I'm working on is trying to start a grant program where um, so there will be like certain health fairs that where they'll be able to come on a monthly basis to
Yeah.
get that provider interaction, to get the education, to get assistance for medications. There is assistance out there where it's going to be hard for all of us to find them, but there is assistance out there, and some of these patients and those mature individuals that happen to have COPD or asthma, and they're over 65 and they have Medicare Part D, and some of these insurances don't, I mean, they'll cover the inhaler, but guess what? They're paying, 150,
Those
150 some stuff.
co-pays
Yeah, the
murder.
copay is ridiculous. So, and that's not feasible for them, and,
No.
you
On
want
a
them,
fixed income?
yeah, and you want them to be on the inhaler because
Right.
you've seen improvements. I mean, and let's not even talk about the biologics. The
Oh
biologics
my
are
God.
starting to change the game as well. So now that Dupixent will be having a COPD FDA approval. Now that Tespire is on the way of trying to get COPD FDA approval for treating COPD patients. I'm trying to find different ways to bridge that gap. So in my current role, I try to do prescription assistance programs. I try to
Okay.
volunteer at the homeless at a student run shelter
I love
clinic
it.
called the St. Vincent's Clinic in down in Galveston. So I volunteer my time there. Also volunteer my time at the Better Breathers Club. So any way I can go out to the community and engage them with pamphlets, education, prescription assistance program, I will go ahead and fill out the form for them. Okay, because I don't, if they don't need to fill
Sometimes
it
you
out,
have
I
to.
could do it for them,
Yeah.
it's just going to take a couple minutes. And it's not a couple minutes, maybe 15 minutes. But the thing about it is those 15 minutes are necessary to bring better, healthier outcomes to a patient, to another human being. And, that's how you touch individuals. You
Right.
touch them by improving their overall health and their wellness.
Correct. Correct. I totally agree. And you just answered another question. So
Oh,
very
I'm
good.
sorry.
No, no, no. It's good. We're flowing. And I want this conversation to flow like that because I was going to ask, how do you assist patients, with their asthma self-management? And you just said basically it right then and there, helping them with, the prescription
Mhm.
coverage and, assistance. And, people don't know how important that is. It's like, yeah, you have to give them the education, but you also have to give them access to
Mhm.
resources, and sometimes they just don't know where to go.
Yeah. Like, for example, like Dupixent My Way is a great prescription assistance program.
Oh, can
Um,
you repeat that again? I didn't.
Dupixent My Way, it's a
Okay. Mm,
great prescription assistance program. Of course, you have to fit the criteria. But
okay.
if you serve a really diverse population that fits the criteria, it takes anywhere between 4 to 6 weeks for the drug to actually show up to their house, or
Okay.
show up to their place of residence. And Covered My Meds is a great
Mm.
website to
Okay, I'm
use.
gonna take note of that. Cover my meds. Okay.
Yeah, Cover My Meds is a great website to use, especially for if you're having difficulties for prior authorizations.
Mhm.
These type of things, us healthcare providers, healthcare employees, we can use these type of resources and be able to touch our patients a lot more. And it's great that we give education, but sometimes education cannot be the only step.
Not
We need,
alone. I
yeah,
said
we need
correct.
to,
It's not enough to just
yeah,
be like
most
spit
definitely.
facts and information to people,
Hmm.
and then it's just like, okay, well, where do I go? And
Right.
the how, and sometimes the motivation and the
Hmm.
why. Why should I even, like, I've gone so far like this,
Yeah,
and
and you ask yourself, why should you even? The question is, why wouldn't you? You
right,
want you want to affect change in people's lives. That's the whole reason why you have
perfect
healthcare.
impact.
Yeah,
Mhm.
you want to have that impact, and I understand it could be time consuming, but I guarantee you, if you look at the time that you spend and the effectiveness that happens later on, the outcomes that happen later on, that will even draw you even more deeper into trying to get patient interaction, more deeper into trying to get
Mhm.
prescription assistance for these patients.
Yes, 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 yes. And we want to keep them engaged. And
Yep.
I always say this, like, because asthma, COPD, these are diseases that's going to be with them. It's not
Yep.
they have to be engaged in their own self-management.
Right.
And that in its own is it's a journey. It doesn't happen overnight. And
Right.
so, yes, okay, I'm loving this. We're doing real good. So yes, like I said, you just answered my other question. So what and you, I believe you said that already too, but so what are the common challenges that you see for those with asthma, COPD as a pharmacist?
So the one of the things I see is the overutilization of albuterol. So I love
Ah,
smart therapy. Yeah.
preach.
Yeah. I mean,
You know
even
me.
in the prison system, they used albuterol to get high. So, yeah, they used it. I mean, you give anyone, time by themselves in a 6 by 6 room, they're going to find ways to
Yeah.
cause to have energy for themselves, right? So, uh,
Wow.
yeah.
Okay.
So, and also vaping. I think vaping is another obstacle, especially with this younger population and
Hmm.
it being more accessible because of these stores that are coming up. I find that to be a very strong obstacle in a lot of my patients' lives. It's hard to treat COPD if you're doing the same thing that causes the
Yeah.
destruction of COPD.
It's
So,
smoking is
um,
so it's a bad, it's just it's so hard. And
right,
I tell people to be as empathetic as possible because I'm trying to cut sugar out my diet. And
mhm,
I it's so the it's so hard. Addiction, I feel like I'm addicted to sugar.
right,
Literally the
mhm,
headaches, like you feel crappy.
yes,
So I can't, I've never been a smoker, so
right,
I can only imagine
yeah.
how deep of of how hard that is to end that habit.
I
So
I am with you. The addiction is definitely there. Speaking to a person, it was like I think uh, July of last year to this year, I've lost 126 pounds, but it took me
wow.
it took me 40 some odd years to basically get it down in my head that I want to live a long life and I want to lose weight.
Yes.
And I
Yes.
had to find the will or the discipline, but it's different for everybody. It takes,
Yes.
everyone has that moment where, it clicks, right? So whatever that moment is up to us as healthcare providers to get them to that moment or to see, whether it's a visualization. So one time I used For my patients at the St. Vincent Clinic, I use that model to show what does cigarette do to the lungs. Now, did it click for everybody? No, but I was able to get 2 patients in our smoking cessation program.
Nice. Let
So
me tell you
I
something.
call,
That is
yeah,
success.
yeah, I call that a win. I don't care if it was 2, 1, or half.
You understand? Mm-hmm.
Yeah. So basically, whatever it is, it's going to take that one moment, that one that one kickstart to get people in gear. And whether it's weight, whether it's smoking, whether it's whatever addiction it is, it just takes that one moment, and we got to be the one to propel that moment to our patients.
Yes,
If that
sir.
makes sense.
Totally agree. Okay, so with that being said, is there any advice that you would give to anyone that is interested into getting into patient advocacy space, like especially within chronic disease management, lung diseases? So what advice would you give, if any?
Yeah, I think the advice I would give is I like listening to other people speak about my passion. I like listening and see what they have to say, and then I like to interpret what they have to say in my own words, and then I like using visualization. I'm a very tactile guy.
Okay.
For as a professor, I use escape rooms, actual escape rooms, in order to bridge the gap of knowledge of asthma to my students.
Nice.
So I used inhalers, I used spirometry, I used mannequins doing breathing in and out. I used a lot of little nuances in order to
Nice.
touch in order to for my students to touch and understand asthma. So my thing is, I would encourage anyone to listen to multiple speakers, listen to a variety of different patients tell their testimonies and stories,
Okay.
right? Because asthma and COPD affects everyone a different way. And
In
yes,
some type of way.
yeah, and yes, there is the pathophysiology may be the same, but it affects people a different way. And
Correct.
in order to listen to testimonials from patients, you will gain a greater knowledge of understanding asthma and COPD, and ergo, you will try to find a way to advocate for those patients, because those stories will string on your heart. I really believe that. You ever had a patient that have COPD or asthma, and you try to get them to do spirometry and they can't, or
It's so,
yeah,
yes. And
yeah, and they
I
run out of breath.
coached a
Yeah,
few patients and they couldn't do it.
yeah, and you run out of breath, and you're just like, why is that happening? I mean, yeah, you could do it, but again, you're talking to someone with a very poor lung function. You're talking to someone with a very poor inspiratory flow rate. Why they can't use certain inhalers and why they can use this. So I really would encourage anyone trying to make a constant effort to listen to a variety of speakers. Also, try to if you want to get into the game of asthma, COPD, try to be at the top of your game. So try to get the credentialing, try to
I,
yeah,
I'm the asthma lady. I be telling folk all the
yeah,
time, just go get it, study,
yeah,
put the letters behind your name. Why not?
yeah. And I'm thinking about getting that certification. I think it's through the uh I think it's AAE, that is the pulmonary function
Yep, PFT.
certification. Yeah. So I'm thinking about doing
Oh,
that.
that's
I
through
don't.
the NBRC too.
Yeah, and
Uh,
BRC as well. So I'm thinking about doing that, seeing if I can do that, since I am a pharmacist. But I do it so often. Now I am going to study for it though. I'm not going to take it, not going to take that lightly. But I think I do it so often, and I basically educate my students on it. Even though they're pharmacy students, I try. I think by doing that, I can only hopefully gain the respect of my peers, and also feel that I have a better grasp of respiratory therapists, pulmonologists, about the little nuances and idiosyncrasies that they go through regarding spirometry and things of that sort. So if you have a passion for it and you want to help your patients, you got to be at the top of your game, and you're
yes,
going to have to be able to break down concepts for their understanding.
correct.
So
That connection and
yeah,
it, keep them engaged.
you
Yeah,
got to keep them engaged, because that's the only way they're going to bring a healthier life
correct,
to themselves. So
correct,
yeah.
correct. Well, thank you so much, Damien, for that. And So is there, so this is the time to plug. I always
Yeah.
give people an opportunity to plug anything that they're doing on RT Share T podcast. So what you got going on? What's your next thing? Go ahead, plug away.
So my next thing is trying to get that grant lifted off.
If
You
you
know,
need
right
help.
now. Okay, I hear you. And I just want to also, give a shout out to you. I mean, I have looked at your bio as well, and you're at the top of your game. The fact that you're doing
Oh,
stuff
thank you.
yes, the fact that you're doing stuff independently and you are killing it with your presentations. I've listened to a couple of
Thank
your
you.
podcasts. I also have listened to some of your presentations.
Thank
More
you.
shout out to you. You
Appreciate it.
you did it. You did it for yourself, by yourself, and I think that's awesome. I think going forward with me, I think working on the grant, always trying to teach within the respiratory therapy school, the PA
Okay.
school down here. Maybe right now I'm an adjunct professor at Texas Southern University College of Pharmacy. Uh, I think I always want to have my hand in academia, but I'm trying to get this grant lifted off
Okay.
where we can have monthly health fairs for our COPD and asthma patients. We'll
Okay.
be doing spirometry, inhaler education. I'm trying to get to garner a pulmonologist to come out as a part of their.
I was gonna suggest he's retired, but Dr.
Oh,
Leroy Graham, he was the
Leroy Grant.
Dr. Leroy Graham, yeah, he was the director of the Not One More Life program, huge program. And he
Okay.
was everywhere. So he retired not too long ago. So he is one of my mentors,
Oh, okay. All right.
Dr.
See,
Leroy Graham. So I might,
yeah,
might be able to finagle something,
I
So
appreciate it. I
yeah, yeah,
appreciate it.
yeah. So hang in there.
Yeah.
So
But yeah, going forward, that's where I think I'm gonna focus most of my time, especially outside my job, and also biologic health. The biologics, trying to make it more affordable for our patients,
yes,
whether it's
access.
dermatology, asthma,
Severe
whatever.
asthma. Mm-hmm.
I think Mark Cuban has done a good job with his little insurance discount program with Humira. The
Oh, I
biosimilars are
didn't
coming
know
out.
that.
Oh, sorry.
I said I did not know about that one.
Yeah. So yeah,
Okay, you can
he's
drop
doing
that
a
one
good
to
job
me
with
too.
that, lowering the price for that. But since the biosimilars are coming out, I think we'll see a shift in price change with some of these biologics.
I
And
hope so.
I would like to be the advocate for our patients as well as the advocate for our providers, knowing that these biosimilars are as effective as the reference biologic. So that is that is my overall goal of these next 5 years, and hopefully get my daughter into a affordable art school that she desires. That's another goal of
Oh,
mine,
nice.
and hopefully she likes volleyball because right now she's killing it in eighth
Yeah,
grade.
my sister played volleyball.
Okay,
She
there
was
we
the
go.
team
There we go.
captain back in the day. So
Okay,
yeah, that's
cool.
a good one. That's a good
Yeah,
spot.
yeah.
Dr. Fisher, thank you so much. This
Oh, no
was such an
problem.
amazing, amazing experience to have you as a guest co-host. I loved everything that you said. I agree with everything. And like I said, you are a true unicorn. And I knew it. I knew when I saw, everything you were doing in on social media space and I saw your profile, I was like, yes, another unicorn. Because I'm in that space too.
Thank you. Thank you
So
so
yes,
much. I really
thank you so
appreciate it.
much. And once again, thank you for your time, sharing your perspectives on RT Share T. We really, really appreciate you.
Thank you
Yes.
so much. I
So
appreciate the opportunity.
all right, guys. So thank you so much for being here. Don't forget that we are here on most podcast platforms on Wednesdays, and we are on YouTube on Thursdays. And we have so much more to come. We are growing together. All right, guys. So I will see you next week. And remember to invest in yourself and to only compete with yesterday's version of you. See you later. Bye.
Thank you. Bye.